Welcome to NCCI's State of the Line podcast. I'm your host, Christine Pike. In today's episode, we'll discuss the latest on medical inflation and its impact on workers' compensation costs. We'll also explore cost containment strategies unique to workers' compensation that aren't typically found in group health. Joining us today are NCCI experts John Sinclair and Stephen Cooper. Welcome to the podcast, gentlemen. John, let's start with you.
I'm excited to be here. I'm John Sinclair. I am a fellow of the Casualty Actuarial Society, and as a director and actuary here at NCCI, I basically focus on anything and everything medical. That's from validation of the medical data we get in the door from carriers, to the usage of that data in legislative pricing, and through onto various research projects.
And Stephen, tell us a little more about you.
Yes, thank you. Stephen Cooper, Executive Director and Senior Economist here at NCCI, joined a little over a year ago. So I look at everything in the economy and how that relates to workers' compensation. And as we all know, there are a number of economic factors that are important for workers' comp, also medical factors that are important for the economy as well. So John and I have a lot of overlap, and we've got a lot of fun stuff to talk about today.
And so this is a topic, medical inflation, workers' compensation costs that both Stephen and I are extremely excited to talk about today. It's not only because it's a top industry concern we continue to hear about from stakeholders, but also because I'm an actuary and he's an economist, and this stuff is just really interesting to us.
Yeah, we should write a song about that. He's an actuary, I'm an economist.
We clearly have the dream team here. So, Stephen, in addition to the economy, you do know a thing or two about medical inflation. Do I have that right?
Yeah, so one of the most interesting and I would say well talked about topics in the economy over the last couple of years has been inflation, more broadly inflation in the economy. But medical inflation, obviously very important for workers' compensation, very key thing that we follow here. And that's the reason we're here to talk about today. There have been some differences in the two of those, what's been going on in inflation in the economy and what's been going on in specifically medical inflation for workers' comp. Yeah, and because of those things being so connected, inflation in the economy and inflation in workers' comp, and because of those differences that I talked about, here at NCCI, we developed our new Workers' Compensation Weighted Medical Price Index, or WCWMI for short. That way we can get a better look at just the inflation that is impacting workers' compensation and strip out some of the other things that are happening just in the economy.
And Stephen, I think you've really hit the nail on the head there. And what our goal today is, we're going to pull back the curtain and really get into some of the details around just why workers' compensation, medical inflation is different from that overall general medical inflation we see. And I'd like to start with the first and potentially most important factor, which is just the existence of fee schedules in workers' compensation. Medical fee schedules set a maximum amount to be paid for a medical service. Now, Stephen, I'm going to spring a quick test on you here. It's pretty tricky, but I think you economists are smart, and I think you're going to get it. So, are payments that we see in workers' compensation typically above the maximum amount or below the maximum amount?
That's a good question, John. I'm going to pretend that I don't already know the answer, but I'll say below, since you mentioned that they were a ceiling.
Stephen, I knew you economists were smart. So they provide a limit on workers' compensation payments. And so we typically see payments below that upper limit. And this also limits how much the payments can change from one year to the next.
Yeah, so we have a really wide variety of fee schedules across not only states, but across these different categories of care. And that's another place where the WCWMI differentiates itself from other medical inflation indices that we have out there. Some of these fee schedules are going to be based on Medicare, so we can look at Medicare pricing. Some of them are going to be based on overall expenditures, so we can look at private insurance and all other payers as well. And so this gives us more costs that are closely aligned with workers' compensation rather than those based on everyday consumer prices.
Definitely. Yeah. And Stephen, as you were talking about there, the different types of fee schedules covering the different cost categories, most states have a fee schedule covering physician services. And for context, payments to physicians make up the largest share of medical costs in workers' comp, around 40%. So most states have at least some level of medical cost containment, and that aligns with the subcomponent of the WCWMI that you and your team have incorporated. Beyond that, there's fee schedules covering hospital inpatient, hospital outpatient, and ambulatory surgical centers. They're slightly less prevalent, but still pretty common. Around 2/3 of NCCI states have fee schedules covering these types of services today. And as Stephen mentioned earlier, one of the most common ways that a workers' comp fee schedule is constructed is incorporating either some or all of the payment rates published annually by Medicare. Coincidentally, I've actually authored the last several articles in NCCI's series, which examines Medicare changes and their potential impacts on workers' compensation.
Yeah, so John, you mentioned the difference in fee schedules that you have between physicians and in hospitals, a little more prevalent in physicians, a little less prevalent in hospitals. Do you think that has an impact on the amount of inflation we experience from year to year in those categories?
Certainly, Stephen. So that's what we see as physicians with more fee schedules, and those fee schedules being based on Medicare. We see less price inflation in workers' comp physician than we do in, say, the outpatient, inpatient, ambulatory surgical centers, where there's less penetration of fee schedules and a little bit less reliance on Medicare.
Yeah, that's good to hear because we see the same phenomenon in the workers' compensation weighted medical price index. Physician services is the largest category of care that we have in workers' compensation, and we typically see a much lower rate of inflation in physicians compared to what we see in hospitals. This is just one of those contributing factors as to why.
Stephen, let's talk a little more about the WCWMI. Why did NCCI construct the WCWMI, and what makes this indices different, and what does weighting these categories all together tell us?
Yeah, so this goes back to what I mentioned a little bit earlier. So there's really two things that we wanted to look at here because, again, this is not a very straightforward topic. So we want to differentiate medical inflation from economic inflation, and then we want to differentiate medical inflation in the broader economy with medical inflation specifically in workers' compensation. So we think back first to broad economic inflation. Everybody knows inflation over the last couple of years has been a very, very hot topic. We've had the highest inflation in the economy that we've experienced in the last 40 years at the peak in 2022. And it was just a broad difference from what we had experienced really in the prior 20 years before that. Now, throughout this experience, though, medical inflation had a little bit of a different trend, didn't quite experience the levels of volatility of inflation or to quite the magnitude of what we saw in overall broader economic inflation. Then if we take it one step further, there are some key differences between workers' compensation medical inflation and medical inflation in the broader economy. We touched on this a little bit earlier with the fee schedules and some of those cost containment strategies. Those change how prices impact workers' compensation versus what we said from the everyday person going in to purchase healthcare. The second key thing is the categories themselves and the weights that go on those categories. In the broader economy, we have these very large, expensive procedures and categories of care that are dominating in the medical landscape. Think of cancer treatments, think of these very big, expensive inpatient surgeries. We don't typically see as much of that in workers' compensation. And as such, we actually see very different weights. So we talked earlier that physician services at 40% is the highest weight for workers' compensation. Next, we have hospital outpatient at about a 27%. That includes ambulatory surgical centers. And then we have hospital inpatient at about 13% behind that. In the broader economy, those categories are largely flipped. Hospital inpatient is the largest weight in the broader economy, and physician services is a little bit lower. Now, this is key when we think about those cost containment strategies and physician services having a lower rate of inflation over time, with it being a larger category for workers' comp. So by cutting through a lot of this noise and getting those weights matching what's going on in workers' comp specifically, we can see a rate of inflation that is much more in line with what we're experiencing in comp rather than what's going on in the broader economy.
We've talked a bit about the pricing and how we measure medical inflation differently, but I imagine that even the types of injuries in workers' comp and the treatments provided are a little bit different than traditional group health. You mentioned cancer treatments. Tell me a little more about that. Why is it different?
For sure. And this is exactly what Stephen was just talking about in physicians and inpatient being flipped in terms of which represents the largest share in work comp versus general health. There's different injuries, and then there's different services provided to treat those injuries. And it sort of starts, right, with the goal of workers' compensation, the goal being to return the injured worker to gainful employment. So that's a higher threshold you can think about than general health or Medicare. If you have a construction worker, for example, returning him to gainful employment is a higher threshold, going to require potentially more treatment because he's got to go maybe climb up a ladder carrying, a 50-pound bag or something versus what I do in my everyday life with it, which is nothing close to that strenuous. And so in the example of the construction worker, they might need to receive more physical therapy, right? So that's additional physical or therapy services. That's more payments to physicians in workers' compensation relative to an injury that occurred in group health or Medicare. Then you also have to consider the demographics, right? Who's receiving treatment? That also varies. Your average patient treated in workers' comp, for example, is going to be a lot younger than your average Medicare patient. So that's fewer comorbidities. Maybe they don't need to stay in the hospital for as long because they're younger, they recover more quickly, and are able to be discharged more quickly. And that follows through into just also the injuries and medical conditions being treated, which can vary significantly. As you mentioned, Stephen, cancer treatments, that's something you're going to see in general health and Medicare. It's not as prevalent in workers' compensation. Another example, these new drugs like maybe Wegovy or Ozempic, which are being used for weight loss. These are high-priced medications that are becoming more common, but not so much in workers' comp. And so those are just some quick examples of some treatments for medical conditions, seen more commonly in other systems as compared to workers' comp. What we do see in workers' compensation too is there's an elevated exposure to serious injuries, right? You have that same construction worker I just talked about. He's exposed to more risk of serious injury than a typical person going through your everyday life. I myself actually spent a few summers working demolition. And while I was at work, I experienced a whole lot more exposure to serious injury than I ever do walking around my house and going to the park with my kids. So that's pretty clear. There's more exposure to risk, and with that exposure comes more serious injuries. Now, many of these severe injuries, they've traditionally required some level of inpatient stay.
So, John, you said traditionally. Does that mean that inpatient stays are no longer happening? Are they less frequent? What's going on here?
Certainly, in some cases, they just may not be happening at all anymore. This could be due to changes in best practice for treating certain injuries. Perhaps an injury always previously required a invasive surgery and now might be treated through physical therapy and injections or something like that. A change in best practice can certainly and has reduced the number of inpatient stays happening. But the more significant shift, though, is simply based on where surgeries are taking place, a shift in venue. So this is something we actually covered as part of the recent medical trends presentation at AIS. And the overall idea is pretty simple. As technology and surgical techniques evolve, injuries that used to require overnight stays in hospitals are now able to be discharged the same day. So with this, is the idea that a surgery in an outpatient or ambulatory surgical center generally costs less than that same surgery performed on an inpatient basis.
And John, that's because staying overnight in a hospital might require additional monitoring, other things like that, right?
Exactly, right. And so we have a situation, though, which is a little bit interesting. We have prices, if we look at the publicly available price indices or our workers' comp medical data, we have prices going up at inpatient facilities, outpatient facilities, ambulatory surgical center facilities, all individually. But what we're actually interested in is the price paid by an insurance carrier. And that can actually go down over time. If we see movement of these surgeries, instead of being inpatient, the highest price, the highest cost venue, these surgeries are now taking place outpatient and ASC, we can see prices coming down over time, even though prices at each venue are actually going up.
Yeah, John, that's very important too when we think about this whole equation for workers' compensation, because as you've said, as I've said, as others have said, price is just part of the picture here as well. So when we're thinking about medical inflation and how prices are changing, inpatient stays being about 13% of workers' comp medical costs. So these higher rates of inflation are a little bit less impactful overall from the pricing perspective. But when you take into account these shifts in where these procedures are being done or the changes in utilization as well, you can get to a little bit of a different outcome, which is why the utilization work that we've touched on at previous AISs and more to come in the future are so important to this equation.
That's a great point, Stephen. And yeah, mentioning the utilization work, we've done physicians, which we presented at AIS 2 years ago. This past year, we covered inpatient, and currently in process, we have the other major medical cost categories: outpatient, ambulatory surgical centers, and drugs that we will be unveiling over the next 2 years. And we're very excited for all of that as well.
So, gentlemen, we have addressed quite a bit here today. And I know that higher rates of inflation don't necessarily translate into higher rates for medical prices. There's a lot more going on.
Absolutely. The picture is not clear-cut and straightforward, as we've been saying, and that's why we're here. We're here to help provide more information, get our audience more educated so that everybody has what they need to make better decisions and to keep the workers' compensation system healthy.
And if you'd like to find out more about what's going on in medical inflation and with medical costs and workers' comp, check out ncci.com for our latest Medical Inflation Insights Report and the Medicare fee schedules and workers' comp in 2024. Thank you, John and Stephen, for joining us today.
Thank you for having us. Had a great time.
This was a great discussion.
And if you'd like to get in touch with John or Stephen, you can reach out to them at insights@ncci.com. We read and reply to every email message we receive. And if you enjoyed this episode, subscribe, leave us a review, and share this program with your network. It'll really help us grow the channel and reach more listeners just like you. Find more episodes at ncci.com/podcast, where we cover even more on the issues that are top of mind in workers' compensation. Thanks so much for tuning in to the State of the Line podcast. See you next time.
This podcast is the copyrighted material of the National Council on Compensation Insurance, 2024. All rights reserved.